Thank you very much for coming. This is, I think, an important day for the citizens of Milwaukee County, especially those who have family members and families themselves that suffer with mental illness. We have an opportunity here to make some significant changes, I think, in a program that has been flawed for many decades. And it is well documented that we have problems that need to be fixed. I have put together a white paper that our Senator Vukmir and I had compiled some facts about the issues that we've had here in Milwaukee County. And while we went back for 20 years in the paper that we have put together, you really can go back 30 or 40 years and see that some of these problems are here. So many of you know I was on the county board. I got elected in 2008, and one of the very first issues that I had to deal with was a mental health issue. The first constituent call I got was somebody who had a relative in the mental health complex. The first big issue that we dealt with as a county board was whether to close the facility on the county grounds, move to a different location. So this has been a topic of interest for me for quite some time. And in 2010, in the wake of some additional problems that have been happening at the hospital, Chairman Holloway started a couple different task forces, and he put me on those task forces. And at that time, I really didn't know a lot about mental health care, and I asked the chairman, why are you putting me on there? I don't know a lot about mental health care. And he told me, you know what, nobody on this board does, except for one person at that time, Supervisor DeBruin. He said, but we have some real situations, problems out there, we need to get them taken care of. So I want to thank actually Chairman Holloway for giving me the opportunity to get into this problem and to work on it. And I especially want to thank Senator Vukmir for joining the fight with me here today in an issue that, as I said, has gone on far too long. So the bill that we're going to introduce later today, it looks like it's a big deal. It's 40-some pages long, but it really is not a big deal. What this does is this bill is going to put together a group of medical professionals, healthcare professionals that will be making the decisions for mental health care in Milwaukee County going forward. One of the problems that I discovered as I was on the county board is you know, we have some very important services and some people who critically rely on these services, and it falls down to elected people who are not experts to make these programs, make the policy decisions for these programs and provide them, and we really are not the best people suited to do that. And when you take a look in statute, in Chapter 51, specifically 5142, it was envisioned years ago that there would be specialty boards that would be set up that could advise people like us who are not medical professionals in mental health care and to help us set the policy. Well, Milwaukee County has never really relied heavily on that model. We've relied on a different model, and it has resulted in some of the problems that I think that we see today. So Senator Vukmir and I are not designing a mental health program for Milwaukee County. We are simply taking and putting a board of professionals in place that will design the program. We want the best qualified people possible making the decisions. We want to remove the decision-making process from all the outside pressures that have influenced it in the past, political and other pressures that have prevented the real reforms from taking place. And we want to have a board in place whose sole responsibility is to put a program together that is best for the patients. End of story. So the bill is going to start with a 13-member board. We have 2 non-voting members that are going to be representatives from the academia, and we have 11 voting members. Of the 11 voting members, 6 of those voting members will be nominated or suggested by the county board itself. 3 from the county board, 3 from the county executive. The remaining 5 individuals on the board are going to be nominated by the governor, but they're going to come from input right here in Milwaukee County. So I want to stress that, you know, as opposed to things that had been done in the past, for example, with the Bureau of Child Welfare and with the Income Maintenance Services Division, where the state had come in and taken those programs over, we're still keeping the delivery of mental health care a Milwaukee County program. This is a county program. It'll be administered by the county. The contracts and the policy and everything will go through a regular procedure that normal departments of Milwaukee County go through. It's just instead of having the county board being the final sign-off on policy, we're going to have this specialty board in place. So we envision that this board then will be able to take and basically start from the bottom up and create a mental health care program that's going to be evidence-based, and it's going to be, its primary function is going to be to take care of the patients first and foremost. With that, I'll turn it over to Senator Vukmir, and then, as I said, we'll be happy to answer questions.
Thank you, Representative, and thank you all for being here. I'm very, very pleased to join with Representative Sanfelippo on what I believe is a very, very important initiative that we are proposing this afternoon. You know, I've practiced as a nurse in the city of Milwaukee for several decades, and I also was, as a nursing student in the late 70s, worked at a local emergency room. And we saw firsthand when I was there the incidents of individuals coming in, sometimes at their worst, at the most difficult time, when they're the sickest. And over again, these people would come back on a regular basis. And that is one of the statistics that I think we have seen in the most recent media accounts about this particular problem as it's facing Milwaukee County, when you have greater than 30% of the individuals being seen in the emergency room and then being repeatedly coming back within 60 to 90 days. We need to change the way that process occurs and get people care in the community and in the outpatient settings. And we hope that by putting together a group of professionals who really understand mental illness, that they're going to help us come up with a system so that the best care can be given to these individuals. Something has to be done. You know, we've had a great focus over the course of this last session on mental illness. Just this week, Governor Walker will be signing many key pieces of legislation that, on a bipartisan basis, we brought forward to deal with mental health issues. And I'm very pleased that now we can move forward with this initiative as well. There are many best practice models that exist across the nation and even right here in our own state. The one that comes to mind in Madison is the assertive community treatment. And here's a program that we don't have to go very far to look at and see how individuals are being treated on an outpatient basis and in their community, keeping them closer to their families and their support systems. And I think that's the focus that we think is the best approach. And the only way we're going to get to that, because it hasn't been happening, is to bring together the professionals who really understand mental illness and can help advise and get things done in a correct manner. So I'm very excited to work with Representative Sanfelippo on that, and we will take any questions that you may have.
Can you talk about the pressure that has been brought to bear over the years and holding back a move to relying on medical professionals, and what's interfering, and can you give a specific example of that?
I think probably at the root of the cause is just the fact that you have the ultimate policy makers, our elected officials, that don't have a lot of knowledge of this area. And so we're kind of apprehensive to take that step forward and make a move because we don't want to make matters worse. But I think after looking at the reports that have come out over the last 20 or 30 years, and the fact that most of them, when you read one, you've almost read them all. They all say the same thing, but nothing has done time and time again that I think that it's time for us to move forward, in other words. You know, the suggestion has been made that, you know, maybe we're moving too fast, we should slow down and try to look at other models. After 30 years of seeing reports and not having any action, it's time to move forward. And we're not sitting, you know, saying that what we're proposing here is a silver bullet and that's going to fix every problem and make everybody happy. I think the problem is people have been waiting to try to get everybody to wrap their hands around the same thing and say, okay, let's move forward. We've waited for 30 years and that hasn't happened yet. How much longer can we wait? We have probably, I would argue, the most critical service that the county provides. And again, you know, this is not done by choice. This is a mandated service that the county provides. but nothing has been done to upgrade it since the inception of the hospital, for example, which when it was built in the 70s, even at the time it was built, the rest of the country was moving away from a large institutional type care, but we have stuck with it all these years. So it's really time to make a change. And then there's other pressures too. It's just, unfortunately, government a lot of times falls in the habit of, well, we've always done it this way, so this is how we're going to continue to do it. And again, by bringing in the medical professionals from all walks of, from all areas of service, with inpatient background, community-based care, the academia, even the families and consumers themselves, we're going to have a good group of people with vast experiences that are going to be able to focus the program on the patients themselves and move it forward.
Is there another county that has a board, or would this be the first in the state to have a board like this?
The board that we're creating here in Milwaukee County is going to have more authority than the other boards that are like it around the state. So to answer your question, yes and no. Yeah, 5142, what's commonly referred to as the 5142 boards, when you go back to their idea or their inception, they were meant to have professionals in place to provide the type of advice to people like me who really don't know. I'm not a trained professional. Senator Vukmir is much more training than I do, but how am I really capable of saying what is the best service delivery model to utilize? So these boards were meant to be put in place to be used for outside advice. But in Milwaukee County, we haven't done that. And, and that's for a variety of reasons. It's just even the way the whole structure is set up with our own administrator and our own department. So what we're going to do here with this bill is we're taking, like the Behavioral Health Division, if you take a look in the county's budget, the org unit 6300 is the BHD. We're literally carving BHD out of the county DHHS, and we're setting it like a standalone department whose policies for that department will be set by this new mental health board. And that really kind of flows in line with the 5142 boards, except that we do give this board a little bit more authority.
Any other questions?
Would you argue this board would be accountable to taxpayers, though?
Yes, because of the fact that you have 6 out of the 11 voting members are appointed by elected officials. That was one of the things that were very important to us as we started going down this path of exactly what we were going to do. We looked at several different models. We looked at the authority model, similar to the UW Hospital in Madison, the way that's set up. But both Senator Vukmir and I are very interested in keeping local control and having some accountability. Neither one of us support the concept of unelected boards having taxing or bonding authority. So by keeping this county program, having the spending go through the treasurer's office, everything is under the scrutiny of the comptroller in Milwaukee County, you still have all of Milwaukee County elected officials with their hands on the program nearly as much as they did before. Like I say, just with the exception of the policymakers. So that's all we're doing, is we're slipping the county board out and putting in this mental health board. And that gives me to another point that I'd like to stress is, there's been a lot of finger pointing and blame game going on, and that's not helpful to anybody. This problem is not a reflection of this county board or this county executive. These problems are well documented and they have gone on for decades. So this is just, this is something that has always been there, and what we're looking forward to is a good, robust conversation in the community with everybody involved to get to a point where we're moving forward in improving service for the people who rely on these programs the most. And in the end, we expect that we're going to have a broad range of support. As Senator Vukmir mentioned, all of the mental health bills that we passed so far in the legislature have had bipartisan support all across the board. And that's because, it doesn't matter what your political persuasion is. This is not about politics. This is about the people. And so we need to put everything aside and focus on what's best for the people. And I really think that in the end, we're going to get to a point where we're all going to be able to embrace this in moving forward. I don't know anybody who could look at these articles that have been in the Chronic Crisis series over the last year and not be moved, compelled to take some action. Maybe we don't have the exact plan in place right now, and what we pass, hopefully this spring, maybe it'll look different in a year or two, but we cannot wait any longer. We have to move forward.
And if I could just add to that, it really is, the accountability piece, that piece is still here, and it's really important that it is there. But you have to understand, and I know that both Representative Sanfelippo and I have alluded to this, it's very difficult sometimes when you are dealt with a variety of issues that are on your plate as a county supervisor or as a state representative or a senator, and you aren't necessarily an expert in all those areas. And to the extent that this bill brings the experts together to give advice to and to help create something that still the board will have oversight on, I think it's really important, because we've too often then decisions are made by us that may not be made because we really understand the best practices or that we understand the best policies. And to those who want to say that this is more government, look, as a representative said, this is already a mandated program. This isn't about more or less government. It's about better government. It's about smarter government and putting people in a position who understand the research and understand best practices, making the best decisions. And again, I cannot say this enough. The fact that we have gotten to a crisis situation in Milwaukee County, we can't continue this anymore. When you look at the statistic that has been given by the, where is that number that I have here, 3,200 individuals in the city of Milwaukee and the county of Milwaukee who aren't receiving any care at all. And that is a statistic that has been given by the Behavioral Division Board, their own statistic. That's a crisis, and something has to be done, and that's why we're here today, and we appreciate you being here.